I'm Emily Walker, MedPage Today, reporting from Washington. Earlier today, I spoke with Princeton economist Uwe Reinhardt as part of a new MedPage Today feature to talk to healthcare experts to get their take on where the healthcare reform debate on the Hill is heading. Reinhardt was at the Capitol participating in a lecture about healthcare reform.
What happened, the Senate Finance Committee was supposed to release an early draft of its bill by last Wednesday. And then the CBO, I think, came out with a very preliminary statement. There's nothing written. I think that may have been more oral, that it would be costing $1.6 trillion, roughly what they had laid out. And everyone went into shock. But it reminds me of the movie Casablanca, where Captain Renault was shocked that there was gambling at Rick's Cafe. They should have known, because a lot of us have talked about 1.6 to 2 trillion to get universal coverage. And if that's what they were shooting for, they should have known that's what it'll cost. So I think they're just regrouping and saying, well, we wouldn't perhaps get 1.6 trillion out of this Congress. So maybe we can get $1 trillion. There's a lot happening, big discussions between the White House, the Senate, and the House committees. So I think personally, this is still on track. The talk about this thing floundering is vastly premature.
One issue that's crucially important for physicians is the sustainable growth rate, or the SGR. That's the formula used to calculate Medicare payments to doctors. Physicians would like to see it eliminated and replaced with something more logical. While neither Senate committee with jurisdiction over healthcare has said it will address the SGR issue in its reform bill, the House of Representatives plan released last week did propose scrapping the formula.
Physicians should realize that SGR has been scrapped a long time ago. It's still there, but every year it never actually operated, because every year it was overridden and they got 1.5% or so fee increases anyhow, which violated the SGR rule. So in some way, here's a rule that's there. It's like a thunderstorm that never comes over your town, so to speak. And they know it never will. So in a way, the SGR rule is already gone. Therefore, the president can really say with a straight face, we can run with this for another 5 years, because we've ran with it throughout this decade, when in fact those cuts should have already come in 2001, but they never did. The other thing physicians should know is fees is one thing, but if you ask how much did the taxpayer pay physicians collectively per elderly year after year, that number has gone up at about 5.8% per year compound growth from 95 to 2005 is when I last calculated it. So per elderly, American physicians have been receiving from the taxpayer an increase of close to 6% per year in money, far ahead of GDP growth. And physicians should sometimes think that way too. Now, primary care physicians will say, we never saw this money, and the answer is, no, you didn't. But why don't you just ask your colleagues in radiology or testing, dermatology, people who use a lot of procedures that are so lucrative, they got all the money. So sometimes physicians among themselves might have a dialogue. Are we sharing fairly what the taxpayer gives us?
Another hot button and decidedly more partisan issue is tort reform. Many Republicans favor putting monetary caps on medical malpractice awards, but President Obama told the American Medical Association recently that he doesn't support the caps because they aren't fair to patients who have been harmed. Dr. Reinhardt also doesn't think caps are the answer to solving the defensive medicine issue. He favors a two-tiered system of peer courts instead of putting caps on malpractice suits.
Well, I don't think caps is the solution, really. What is the solution is alternative dispute resolution, which would mean to establish in every state some body of reputable expert citizens appointed by the governor in staggering ways, so it's not political, who would hear cases of when patients are harmed. A patient was harmed, and this body would then say, yes, they were harmed, and the medical bill should be paid for that person, and there should be such and such payment for pain and suffering off a tariff that seems reasonable. The professional guilt would not be determined by that body at all. That would be delegated to a body of peers, another body of physicians. Because when you say a physician is judged by a jury of peers and then they're postal clerks, that's just utter nonsense on its face, even saying it. So then the malpractice would be handled by physicians themselves. But it wouldn't involve any money payment. It would just simply, if a body of physicians concluded you should never do this operation again, then that should be the case.
Dr. Reinhart said the idea of peer courts has been floating around for the past 20 years, but hasn't gone anywhere because of the sway of trial attorneys.
Trial lawyers are major shareholders in the United States Congress, to put it very crudely.
As for a time frame, while many leading economists predict about a 40% chance of major healthcare reform passing this year, Dr. Reinhart is more optimistic.
Well, it may not be by August, because they may try to get something bipartisan and something within $1 trillion. But I cannot possibly imagine that this Congress and this president could get away with tabling this effort for next year. If you were to say, what is the chance of Obama's vision during the campaign passing this year, I would say not even 5%. I think a lot of that will be trimmed. For one, I think he'll be able to at most cover 60% of the uninsured.
Dr. Reinhart predicts there is a 90% chance of seeing significant reform pass this year, although it won't be exactly what Obama promised, he said. From Washington, I'm Emily Walker, MedPage Today.